Hi everyone. Let's talk about something which is very important as far as the surgery for the prostate cancer is concerned. Now, the why the pelvic muscle exercise is more important the protein shake after prostate cancer surgery. What this really means is we focus on muscle people never talk about. Everyone is obsessed with the protein shakes and the multivitamins after surgery, especially after the cancer surgery. More protein, more strength, faster recovery, right? Here's the thing, after prostate cancer surgery, that is radical prostate surgery, that is not the only muscle group that saves your dignity. It is the pelvic floor muscles which is most important. The muscle nobody sees, the muscle nobody trains, yet one muscle that will decide if you will at all live months of confidence after the surgery or months worrying about wet underwear and leakage every time you laugh, cough, or pick up your grandkid. This is almost like very common after the cancer prostate surgery. Let's talk about science because this is not gym gossip. Study shows that up to 65% of men have urinary leakage right after prostate removal and around 10 to 15% continues to struggle 1 year later after the surgery. Why this thing is happening, the leakage of urine is happening? Not because they didn't drink enough protein, but because surgery temporarily weakening the sphincter muscles and nerves that controls the urine from your bladder. And here's the wilder part. Research from the European Urology Journal shows that men who start pelvic floor muscle training or exercise before surgery generally have recovery and continence nearly twice as fast as compared to those who start later after the surgery or sometime after the surgery. Twice as fast? Protein shake don't do that. Why? Powders does not retrain your nerves. Muscle mass does not teach your bladder control. So the bladder control is a complex interplay between the nerves and your muscles. Think of it like rewiring a control system. After prostate surgery, your brain and the pelvic muscles need to relearn like to work as a team. That is the teamwork. It is like switching from an automatic gearbox to a manual gearbox. Suddenly, if you never practice clutch control, the car will stop. Same is with your bladder. Pelvic floor muscle exercises are not optional fancy extras. They are part of the rehabilitations as essential as physio after knee replacement surgery. Yet hardly anyone in India and most patient populations talk about it. Men secretly thinks it's a women thing, so we need not to do it. So let's kill that myth right here. Women's pelvic floor muscles supports childbirth. So after childbirth, there is some weakening or some stretching of these muscles, while men's pelvic muscles control the continence and the sexual functions in them. Same region, same component, but different mission. So in men, the overall control of the urine depends upon pelvic floor muscles strength. Equally critical. Here is the data point nobody quotes online. So a Canadian study shows that men who did at least 12 weeks of supervised pelvic floor physiotherapy not only regained the continence, that is the urinary control, faster but had better erectile recovery after radical prostate surgery for cancer of the prostate. Because the same muscles group support penile blood flow also. So this rehabilitation protocol will help in better recoveries of this muscle. So urine control plus sexual functions, that is in one exercise routine. No supplements can give you that double win in a single go. And yes, protein matters and for healing, but not for getting in control of the urine as well as your sexual functions. But you don't rebuild confidence in the blender jar. You rebuild it with discipline. And one important part of pre-op rehabilitation protocol for all my cancer prostate patients is pelvic muscle training. So if you are preparing for the prostate cancer surgeries or you are just recovering from it, do this. Start pelvic floor exercise at least 4 to 6 weeks before surgery continue daily after catheter removals, and make it a practice or make it a habit to do it every other day. Guided physiotherapy beats random YouTube tutorials because the technique matters. And if I say that 90% of the patients who are doing the pelvic floor muscle exercises are doing it wrongly. This is not about avoiding embarrassment in public. This is all about feeling like yourself again. So walking without pads, walking without catheter, laughing without fear, and being intimate without anxiety is our goal. So ask your urologist, ask your surgeon, ask your physiotherapist what exactly is the exact way of doing a pelvic floor muscle exercise. Don't whisper about this, talk openly, because silence makes the recovery slower. Thanks.